Hi learners, welcome to our last mini lesson for the GI system. This time we're going to look at some procedures and pharmacology. So here are some common diagnostic procedures. The first one is nasogastric aspiration and lavage. So nasogastric just means through the nose and into the stomach. Aspiration means to withdraw fluid. Lavage means to wash. So basically, we use this to detect upper GI bleeding. We instill some fluid, it sits in the stomach, and we wash it back out, or we aspirate it back out. And the presence of bright red blood in that fluid that we draw back out indicates active bleeding. If we find coffee ground material, it means old blood. Remember, we talked about coffee ground emesis back in one of the previous videos, meaning that the blood has been sitting in the stomach for a little while because it's already started to coagulate. The next term, enteroscopy or endoscopy. In enteroscopy, we use an oral flexible endoscope. Endo means within, scope is just a tool to visualize a scope that has a little light and a little camera to visualize and take samples from tumors and pictures of things like ulcers, and helps us to control bleeding from places like the esophagus, the stomach, and the duodenum. So again, we're in the upper GI tract. An upper GI barium X-ray is sometimes called a barium swallow. It uses something called barium sulfate, which is a contrast material that the patient swallows, and it's used to study the distal esophagus, the stomach, and the duodenum. This uses an X-ray, which is a little less accurate than using the camera to go down and look at the inside structures. Angiography, we're looking at blood vessels, so it uses a dye that's injected to highlight blood vessels, and we can detect the site of bleeding within the GI tract. A digital rectal exam, digital in this case means your finger, not digital like technology digital, but in this case, digit refers to your finger. So a digital rectal exam is when the physician or healthcare provider palpates the rectum and prostate gland using a gloved, lubricated finger to determine the presence of lesions or palpate the prostate exam. Proctoscopy is a procedure using a proctoscope that allows for visual examination of the anus and rectum and portions of the sigmoid colon, looking for diseases, rectal bleeding, or any abnormal results that are seen on a barium enema. Anoscopy is similar to proctoscopy, and that's an exam of the anus and lower rectum using an anoscope, which is pictured here. A flexible sigmoidoscopy looks at the rectum and the sigmoid colon, and a flexible colonoscopy examines the whole length of the colon. So these use cameras inserted through the rectum. The patient is sedated, of course, and the procedure uses a camera inserted through the rectum and examines the entire length of the colon. In a barium swallow, again, the patient ingests the barium sulfate, which is the contrast material, and it shows the details of the pharynx and the esophagus on an X-ray. In a barium meal, the barium looks at the distal esophagus, the stomach, and the duodenum on an X-ray. And in a barium enema, the barium is injected into the large intestine as an enema, and then X-rays are taken to show just the large intestine. So the previous procedures were diagnostic procedures. These are therapeutic procedures. So remember, one was just giving us a diagnosis. These are therapeutic procedures, which are an intervention for diseases or disorders. Some diagnostic procedures can also be used as therapeutic procedures, like endoscopies can be used to remove polyps or used as biopsies or to stop bleeding, but they can also be used as screening procedures for cancer. A laparoscopy uses a thin, lighted tube inserted through an incision. So the difference here is an endoscopy goes through the mouth or through the rectum. A laparoscopy, now we're making an incision through the abdominal wall. Laparo means abdomen. So a laparoscopy uses a scope that goes through an incision in the abdominal wall to look at the abdominal or pelvic organs. And they can do surgery this way or biopsy samples. They use a laparoscope to maybe remove a tumor or look for or remove abnormal structures. Hiatal hernias or inguinal hernias can be fixed this way. Patients can have their uterus removed, gallbladders removed, appendix removed. Even a resection of the colon can be done laparoscopically. A resection just means that part of an organ or a structure is removed. So sometimes they will do this when part of an intestine needs to be removed. So a section is removed and then the two pieces are put back together. An intestinal resection is done to surgically remove a diseased portion of the intestine, and then the remaining portion of the intestine can be joined back together. When the pieces are joined back together, that's called an anastomosis. If there's not enough healthy tissue to put back together, the patient may need an ostomy. An ostomy is an artificial opening. So for example, a colostomy is an artificial opening from the colon to the outside of the body. An ileostomy is an artificial opening from the ileum to the outside of the body. You can also have a jejunostomy, which is an artificial opening from the jejunum to the outside of the body. In certain procedures, ostomies may be temporary. If the patient has extensive bowel surgery, they may need a period of time for their intestines to rest. So the colostomy may be temporary and it may be able to be reversed. So they may have a temporary colostomy and the colostomy may be able to be reversed. The next term we actually had in a previous video, and it was the abbreviation ERCP, endoscopic retrograde cholangiopancreatography. And this is a procedure that's used to diagnose and treat problems in the biliary ductal system. So in this procedure, an endoscope is passed inside the duodenum and radiographic contrast dye is injected into the biliary tract ducts. And gallstones and pancreatic cancer can be treated using this technique. And the last term is pancreas endoscopic ultrasound, EUS. And this is a type of endoscopic examination that enables very detailed imaging and analysis of the pancreas using ultrasound. So an ultrasound probe is actually inserted in the mouth into the stomach and the first part of the small intestine, which is really very cool. So it's almost like you're passing a little teeny tiny ultrasound all the way down into the first part of the small intestine to get those ultrasound images of the pancreas from the inside. It is a great tool to get images of pancreatic tumors and cysts and to assist in diagnosing acute and chronic pancreatitis. All right, and let's talk about some pharmacology. We talked about reflux or GERD, and in order to treat GERD, we need to treat the excess gastric acid that's associated with it. So antacids are a great way to treat that. We can take them orally to neutralize that gastric acid and relieve the heartburn. So examples of antacids include things like Maalox or Mylanta, which are a class of drugs called aluminum hydroxide, magnesium hydroxide antacids. Milk of magnesia, Tums, Rolaids, those are examples of antacids. Histamine blockers or H2 blockers, those are histamine 2 receptor antagonists. These actually block the signals from specialized stomach cells. So you probably heard of antihistamines like Benadryl. These are also histamines, but they're specialized histamine cells in the stomach. So drugs like Tagamet and Pepcid and Zantac are also antihistamines, but they work in the stomach instead of like Zyrtec and Benadryl block histamines in the rest of the body. Proton pump inhibitors also block the secretion of hydrochloric acid, but they work on different cells in the stomach. So drugs like Prilosec and Prevacid and Nexium are what we call PPIs or proton pump inhibitors. And there's other types of antacids. Cytotec inhibits gastric acid, and that's a drug that specifically is used for the prevention of NSAID-induced gastric acid. So remember, NSAIDs are those non-steroidal anti-inflammatory drugs. There's a drug called sucralfate or carafate, and this drug is interesting because it's not technically an antacid. It forms a protective barrier on the surface of a gastric ulcer. So it's mainly a protective drug rather than an antacid. And then, of course, it's not listed on this slide, but another weapon in our arsenal against gastric ulcers is antibiotics for the treatment of H. pylori, that Helicobacter pylori. Remember, that was the bacteria that weakened the mucosal layer. So antibiotics like amoxicillin or clarithromycin are also used to treat gastric ulcers. Antiemetics are drugs used to treat nausea and vomiting. They are also used to treat motion sickness and the side effects of opioids, anesthetics, chemotherapy. So some antiemetics include serotonin antagonists, dopamine antagonists, some antihistamines are antiemetics, and cannabinoids, like medical marijuana, are used to treat nausea and vomiting. Laxative drugs we use to treat constipation. Drugs are not the first thing we use to treat constipation. The first thing we want to do to treat constipation is increase the water intake and fiber intake. Laxatives would be a last resort, actually. And then anti-diarrheal drugs. First thing we want to do to treat diarrhea is find out the cause of diarrhea, but anti-diarrheal drugs are available over the counter. So things like Imodium, Maalox, Pepto-Bismol, drugs like that will reduce the peristalsis and slow down the diarrhea. Okay, and I think we have finally reached the end of this chapter. So once again, I thank you for your attention, and I will see you again in chapter 6.